You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello, and welcome to another episode of the RN Mentor podcast. Today we have a very special guest, Dr. Susan Hassmiller. Dr. Hassmiller is currently serving as the Senior Scholar in Residence and Senior Advisor to the President on Nursing at the National Academy of Medicine, and as a key member of the leadership team for the Future of Nursing 2030 report. She is also a Robert Wood Johnson Foundation Senior Advisor for Nursing and directs the Foundation's Future of Nursing Campaign for Action. Dr. Hassmiller is an elected member of the National Academy of Medicine, a fellow in the American Academy of Nursing, and sits on other advisory committees and boards, including the American Red Cross. She is a recipient of numerous awards and 3 honorary doctorates, and has received the Florence Nightingale Medal, which is the highest international honor given to a nurse by the International Committee of the Red Cross. So welcome to the show, Dr. Hassmiller.
Thank you. It's a pleasure to be here.
Thank you. I have to admit, this is a bit self-serving because I've always wanted to sit down and talk to you, and having this opportunity is a great honor on my part.
That's great. Yeah. I love doing this during nurses. This is National Nurses Day too.
It is, and happy National Nurses Day and National Nurses Week. So I always like to start with finding out how my guests got into nursing in the first place, and how they set their path when they got into the profession. So Dr. Hassmiller, how did you get started in the nursing profession?
It was an easy one for me. It was my mother. My mother was a nurse. She was a graduate of Bellevue, New York City, very famous hospital, and she was there as a cadet corps nurse. She was quite poor coming out of the Depression and was looking for a way forward for herself and for her family. She was very young, and so she saw this billboard in New York City that said, "Be a nurse," and if you can sign up and pass the test, then the federal government pays your way. So she did that. She passed the test. She went to New York City, Bellevue, and she was one of those nurses with the starch white uniform and the cap and the spick and span shoes and the white stockings. And I saw this growing up, and, she never pushed me into being a nurse at all. But on occasion I would go to the hospital, and what did it for me, Ali, was really talking. Sometimes she would bring me in. It was more informal in those days. And sometimes she would bring me into some of her patients' rooms, patients who stayed quite some time, not like today when you're in and out. And the patients would say, "Oh my gosh, your mother is so incredible. She saved my life. She's so great with my family." And the more I heard about my mother, which I didn't have this image of her, you know how it is growing up, you hear the other side of the story. I thought, wow, this is what a nurse does. This is like amazing. And so I became a candy striper, and then a nurse's aide, and then became a nurse. And I loved it. And I will be completely honest with you. I have never, ever wanted to be anything else.
That's fantastic. How was the new graduate process when you got into nursing? How was that experience for you?
Well, it was much more informal than it is today. If you're fortunate enough to be with a large health system, and I realize that nurses going right into ambulatory care or in the community don't have necessarily the option of a mentorship or a residency. And that's really how it was in those days. I graduated, and I'm going to be showing my age here, but I went to a 2-year community college first. I didn't mention that. We might get into that, but went right on for my baccalaureate degree. But right out of my community college degree, I was, very young, 20 years old. It was the early 70s. And there was no mentorship residency programs at all. It's you just, you finish your program and then you start working on the floor. And it was quite intimidating. And even as a person who grew up with a mother who was a nurse and then a candy striper and a nurse's aide, it was pretty intimidating, the responsibilities that you had very, very early on, that you were responsible for people's lives. And I really felt that. And it was daunting. And there was a time, probably 2 months in, where the stress was really very intense. As I said, there was no residency or mentorship. And I remember laying on the couch coming home from work one night thinking, oh my gosh, this is just so much responsibility. I hope I made the right decision. But it was fleeting, and I stayed, and I've loved every bit of my career.
Thank you for sharing that. I don't think those feelings are any different, even with a residency or a new grad program. Still coming home and like, oh my god, did I make any mistakes, or what did
Yeah,
I do, or
yeah,
so
yeah.
those feelings I think are across the board, regardless of as a novice nurse. I think that's one of the things that I think I remember the most is like I was hoping like as long as I didn't hurt anyone, I'm good. Uh,
I know. Yeah, it's really quite amazing. And when you see, we'll probably get into it later, but I think for the first time, people are really seeing on TV because of the pandemic. They are following nurses. They're in the newspaper, they're in the news. And I think people for the first time are really seeing the actuality of what nurses do, albeit during a pandemic, but it's still the job that they do, and it's really awesome.
yeah, very very proud of all the nurses that are out there, and healthcare professionals and anybody that's still out there working, making sure the country is still moving forward. I think it's amazing the work that everybody's doing. Absolutely.
Absolutely.
Uh, so um, so one of the things I always talk about with at least my students or people I have the privilege of mentoring, I always talk about planning their career, and you've had an incredible career so far. Um, how did you navigate your nursing path? And how did you like some it wasn't I'm sure it wasn't accidental that you just uh, fell into this incredible career. I'm sure some planning went into it. How did you navigate that process?
Well, you're giving me more credit for the strategic plan that I might have had than I really had in the first place. I would say, if anything has guided my career, it's been passion, and saying yes, because I see the students, the young people that I'm mentoring now, and I really advise them to be strategic and write out a plan and determine how to get there. And help. I have a lot of people get to where they want to get to, and I love that. That's the best part of my job and my life now. But it wasn't that strategic for me, actually. I was in acute care, and I remember being on the coronary care unit, and it was like a revolving door. People would, even in the early days, people would come in, and they have a lot of heart disease. They maybe needed some surgery and tests and medications. And, you know, I did the same thing that nurses do now, try to talk about diet and prevention and everything, but people kept coming back. It's just a revolving door. And I didn't really know that there was such a thing called public health per se. But in my head, I thought, you know what, there's got to be a better way than people coming in. We would call them frequent flyers now, but coming in all the time. And I thought maybe prevention, and prevention was just coming into its own in the 70s. I think the President's Council on Physical Fitness was started during that time, if I'm not mistaken. And a lot of talk about prevention. I said, that's what I want to get into, prevention. I got to prevent people from being sick in the first place. So I did that, and I actually went into the community, and my first job outside of acute care was with the American Red Cross. And you talk about not being strategic. How that happened was I went back to school, and when I came home one day, it was sort of house sitting while my parents were on vacation in Mexico City, and I saw this trailer across the television set. And in those days, this was the 70s, there's no cell phone, there's no anything like that anybody would recognize. You'd have to go into very old movies to know that what we had back then was a dial phone. So I saw on the television set when I was home that there had been an earthquake in Mexico City, and I was quite nervous and upset. And my parents were there, and how do I get in touch with them? And I just didn't know. So I dialed 0 for operator, and I said, I'm upset. I just saw there was an earthquake. My parents were there. And she said, I can't help you, but I know an organization that can. And she clicked me over. Again, a very old sort of maneuver in those days, clicking someone over by the operator. She clicked me over to the Red Cross and connected me to a wonderful, extraordinary woman who talked me down and talked me through how she was going to help me and how she was going to help me find my parents in Mexico City. And she did, over the course of a day or two, something that would now take a mere seconds and minutes. She told me that the electricity was down, but nobody had been killed. So she told me the basics. So that was my first impression of this extraordinary organization called the American Red Cross. And when my parents got back home, I went back up to college, and I went straight to 924 North Gadsden Street, which was the local Red Cross in Tallahassee, Florida, where I was getting my baccalaureate at Florida State University. And I walked in and I said, you don't know me, but you helped me find my parents. You saved my parents. And I'm here to do whatever I can for this unbelievable organization. And so that was really getting involved in the Red Cross. It wasn't strategic. I happened into it, and I worked for them. My very first job outside of acute care was to be a director of nursing and health services for the region where that Red Cross served. And from there, I met my husband, and I knew that prevention and community, and I had gotten into disaster work at that time too. So a lot of work with disaster. And then I met my husband. We moved to Nebraska, and then my first job there was at a state health department, and I worked full time as a public health nurse, part time for the Centers for Disease Control for a program they were involved with, and then part time as a public health nursing supervisor. So then from there, I taught public health at 2 different universities. I eventually, and then in Nebraska, I was a public health nurse at the local level. So that's how I made the tradition. It was a complete accident, and it was a tragedy. And I will tell you, tragedies, and maybe we'll get to that a little bit later, but a tragedy is what brought me to my most recent, if you will, area of passion, which is compassion, and at the front lines, and it has to do with losing my husband in a bicycle accident. But maybe we'll get to that in a little bit. But I think you can see that, other than strategically knowing that I did want to teach, I love teaching, so I was reaching out in that realm. And then when I got into teaching, they eventually said, you have to have masters and PhDs and to teach, as you know very well. And so that that path was charted for me as well, because I really thought I was going to stay in teaching. And so when I was in my PhD program, a it was a a degree in nursing administration and health policy. That was George Mason University. And so, as part of that PhD program, they wanted you to have a policy experience. So, I did just that. My policy experience was working at the federal government in public health at HRSA, Health Services and Resources Administration. So my whole career has really been in the community, public health, policy, and that is it in a nutshell, Allie.
Thank you for sharing that.
I didn't really get to how I got to the Robert Wood Johnson Foundation.
We're
So
gonna hit
okay,
that
we'll
in a
hit
bit,
on
but I
that. We'll
definitely
hit on
want to
that.
talk about that.
Yeah,
But I just wanted to say it's I don't know, somebody may have already thought about this, but what I call real time strategic planning when it comes to careers, because it sounds like opportunities presented themselves and you stepped through that door where you didn't have to. But it's
right.
but you definitely saw opportunities and went through and prepared yourself and
I
uh,
think so. I think that's
yeah.
how it happened. I saw opportunities, and as as I said before, you go with your passion. You do what you think you're good at. You be sure to say yes when opportunities come your way. I've met a lot of nurses along the way that have said no, and that they chart their own path that way by saying no.
And it's one of the reasons I got my PhD. I always tell some of my colleagues and my students, I said I never wanted to be in a situation where opportunity presented itself. I wanted to say yes, but didn't have the degree for it. Uh,
Yeah,
that was one of my drivers. Other than if I showed you my high school transcripts, you would have never thought I'd be at this point in my life. I was not a shining student in high school, but things turn around. Uh,
yeah, they
thank,
do.
thankfully.
Yeah.
Thank you for sharing that's an incredible story. I mean, just the fact that you've dedicated such a significant part of your career to community and public health is amazing. So thank you for doing that. Let's talk about your current roles. And you have several of them, one with the Robert Wood Johnson Foundation and the other with the Future of Nursing 2030 report. So let's start with the Robert Wood Johnson Foundation. How did you get into that role?
So I was working at the federal government at the time, and I was actually very much into primary care policy. The person I was working for was responsible for primary care policy within the federal government and workforce. And so at that time, I was directing a policy fellowship, and that was quite an exciting time in my life to help develop a national policy fellowship where professionals, both physicians, nurses, and some others, got to come to Washington, D.C. for a period of 3 weeks and over a year, learn policy and research around primary care. And it was quite exciting. That's when I really got involved in that realm, policy, quite heavily, and learned our political system very well. So it was at that time when I got a call from the Robert Wood Johnson Foundation. I'd never heard of the Robert Wood Johnson Foundation, but they said they had a program, a national program that they were starting called Partnerships for Training, Primary Care Partnerships for Training. And it was going to be a program that brought together nurse practitioners, physician assistants, and certified nurse midwives together to learn interdisciplinarily and then practice together so they would better understand each other's roles. But it turned out it was a big national program, as Robert Wood Johnson Foundation has. And as these programs go, they always have national advisory committees. And so they were calling me to see if I would serve on this national advisory committee. So I did so. And then, probably a year out after the advisory committee had met a couple of times and I helped them do site visits around the country, one of the vice presidents at the foundation said, we have an opening at Robert Wood Johnson Foundation. Would you be interested in coming to work for us? And I said, I don't think so. I don't really know what you do, but I don't really think so. I'm happy in Washington, D.C. area. By that time, I was very, very involved in the Red Cross at the national level, where their headquarters is. We had just built a house. My kids were, one was going into high school, one into seventh grade. So I said no, but they kept asking me. And then at one time they said, well, just come to the foundation and talk to a few of us. It's like, one of those scenarios where you come and look at the puppies. You don't have to buy a puppy, but you do look at them, right? It was part of the game. So I went to the foundation and I learned what they did. And I was extremely impressed that they had this very large endowment, originally started by Robert Wood Johnson of the Johnson & Johnson fame. And they got to really pay attention to the health and healthcare issues of our country and strategize programming and grants and research around, how we might address these big challenges. And to me, that became very exciting to be part of a large national policy strategy scene. And so, very fortunately, I had a husband who agreed with the move, and my kids had to come along whether they wanted to or not. And that was in 1997 that I started with the foundation. And I've done a lot there. First of all, I went there doing primary care and then public health. So I've always stayed in that realm, but that's the foundation too. They are more of that ilk. And then eventually, we had a nursing team or a nursing department, a nursing team at the foundation. And there was a lot of and I headed that up, and we had a lot of programming, many, 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 many millions and millions and millions of dollars to nursing programming and education and research and policy and leadership. And it was really the heyday of nursing. And then our then board chair, Tom Kean, who was the former governor of New Jersey, and you might recognize his name as the co-chair of the 9/11 Commission, Tom Kean, said, we ought to have a blue ribbon national nursing commission. And so he wanted that. The board wanted it. We tried to figure out how we would have the most high-level elite nursing commission ever. So we decided to talk to the Institute of Medicine. And that's when I decided, or I didn't decide, my president asked me if I would actually go to the Institute of Medicine and head up this commission, which I did. And, the rest of that history, as you know, is the report called The Future of Nursing, Leading Change, Advancing Health, which was launched at the end of 2010.
Which was profound in my career because, like I think I shared with you earlier, that's what when I looked at that report, I said, how can I contribute? And when I saw the double the number of doctorally prepared, I'm like, I can do that. And that's how I got my PhD. So thank you for that report because it was a game changer for me as well.
At the time, my president at the time said, it's one thing to do a report, and the Institute of Medicine, now it's called the National Academy of Medicine, but she said there are dozens and dozens of reports, high level blue ribbon panel reports that come out, but she said, I don't want this one to sit on a shelf. And that's when I went to AARP thinking, who better to partner with, who cares about the general public and their well-being than AARP? And that's when we started the Center to Champion Nursing in America. And that's where our operations headquarters is now for this vast and national campaign that we have to implement that first report, Allie.
That's fantastic. Now, talking about that report a little bit more specifically, how did you put that team together? Like when you were looking at who you were going to partner with to put that report together, how did that come about?
Well, that process is pretty cut and dry. If you have enough money, in other words, if you're the federal government, if you're a large foundation, if you have a lot of money, you can go to the Institute of Medicine, now National Academy of Medicine, and you can say, I think this topic is really critical to study and have recommendations on. And once the academy decides your subject is worthy enough to study, then it's really then a very much of a closed door process. They say because they want it to be bias free. They don't want any outside influences, because any report that comes out of the National Academy of Medicine has to be based completely on evidence and research. And that's where the recommendations come from. And they can't be biased by hearsay and advocacy and all that. So they bring together a group of advisors on a committee, and they're experts in that subject matter, very highly vetted. And so that's what we did the first time. We had a highly vetted committee, and then closed the door. It was very unprecedented that I got to go in to help lead this, like I am doing now with this second report. They had never done that at the Institute of Medicine. Once you turn over your money and your idea, they close the door because of bias, and they get their own. They have their own staff there. They get their group of experts, and they deliberate, and they collect research and deliberate and discuss and everything. Then they come up with a series of recommendations, as you know. But it was quite different for me to be there, and it was an honor to really be part of that and to help lead that effort.
Now I know the report, it had more than sat on the shelf, because we had the states that developed that have representation, the Action Coalition.
That's right.
Can you talk about how that came to be? Because on a state level, things need to change on a state level. And given the fact that the IOM at the time put out this report saying these changes need to take place, how did the states' action coalitions come into play, and what's their role?
Yeah. So this is a good lesson for perhaps even students and others who want to study movements and campaigns. This is a good lesson because you have to really start engaging people. I explained earlier that putting together a report and deliberations and recommendations is quite a closed door session. But I know from working at Robert Wood Johnson Foundation, we have a very big communications machine there. It's very robust. And so I have really been schooled in media and public engagement, and how to get the attention of important people's ears. So I knew that even though we were working behind closed doors, we had to foreshadow and engage and get the nursing community excited about this report. So even then, we had town hall meetings, and I'm not sure we had webinars then. The process this time, which we'll get to, I did a lot more engagement, but I did a lot of things. I did a lot of public speaking, all to the effect of trying to get the nursing community like pumped up. This is for you. This is going to be your report. You're going to have to take this and run with it. You're going to have to follow these recommendations, and this is going to be a great thing for nursing. And so by the time the report came out, we had a very big launch in Washington, D.C. A lot of people there, 600 people. We had a big press conference. So many people were on the call for the press conference, that the whole system crashed, which I was very upset about at the time, but now it gives me bragging rights. But you see, so much engagement was fostered that people wanted to do what they could. Like you said, you got it and you wanted to be involved. And so I very quickly, with AARP and the Center to Champion Nursing America, we had to come up with a process by which we would involve people. How would we do this? So I talked to different organizations like the Institute of Healthcare Improvement, the American Heart Association, other organizations that had campaigns. So all of a sudden I was this nurse, and then I was this educator and clinician, and then I was this policy person. And now all of a sudden I'm trying to run a campaign. How do you run a campaign? I talked to a couple of political people. How do you do campaigns? And so I learned from them, and we sort of built the plane and flew it at the same time. But it was really how we got action coalitions together. And all we said was we started with 5 states. California, you're sitting in California. California was one of those states, and it was because the states were chosen based on who the people that I knew there and I trusted, and I knew that they would have a process that they could put together. And when they said, well, what do we do to get started on an action coalition? I said, I don't know. Why don't you just take the report and gather some people around that you know and trust and who really want to get some work done, and come up with a plan as to how you're going to implement recommendation 1, 2, 3, 15, 23. And that's how the action coalitions got started. It was sort of an informal process that very, very quickly turned formal. And then we had to have applications because other states were clamoring to get in. And so we developed an application process. Eventually, all 50 states, 51 because of the District of Columbia, became an action coalition. And the rest is that kind of history.
Given some things have come out of those action coalitions, like for example, the bridge programs that have increased the number of BSNs, and some dollars have come out in supporting doctoral and nursing in general, nursing education. I hear from nurses once in a while. Well, not once in a while. Usually, time and money tends to be the biggest barrier for nurses moving into another degree or moving into academic positions where there's a huge need for nurses to go into. And then once you get like a PhD or a doctoral degree, capacity for jobs, right? Not, institutions don't build a lot of capacity, especially on the service side, for doctorally prepared nurses. How do you foresee this report continuing to have the impact it has had so far, but making sure we're building capacity as far as dollars for nursing education and looking at building capacity for these doctorally prepared nurses?
So when you run a campaign, or if you run a program of any kind, and just say you're trying to make change, right? Let's just say you're trying to make change. Could be anything. Your job is about influence. Who can you influence to come over to your side of the street? And so let's just take the 80-20 recommendation, getting more nurses to a baccalaureate degree. So it wasn't just a matter of telling nurses in this country, you need to get more educated, right? You need to convince chief nursing officers that that's who they want to hire. You have to convince CEOs of health systems that if you want to hire more baccalaureate nurses, that you're going to have to pay for their education, because you're not always going to have the supply that you want. And if you want to reach this goal, if you want to be as safe as possible, if you want baccalaureate educated nurses, you're going to have to pay for that. So then you get into policies, and then you work with organizations like Magnet, who then put a criteria for even applying for a Magnet. Even to apply for Magnet, you had to have a plan for how you were going to reach 80-20. So you put policies in place. And then you talk to people like the federal government, because again, if your goal is to get more baccalaureates, you need more people, you need more money, right? You've alluded to that. So then you have to work with the federal government as well for more scholarships. Then I had to work with my own foundation and other foundations to support programs around furthering nursing education. So it's like this big, massive plan. If you really want something to happen, it's not a simple write a recommendation and people are going to fall in line. You're going to have to work with a lot of different people across disciplines. And that's the value of interprofessional collaboration and multidisciplinary collaboration, and putting yourself in the other person's shoes. I'll use one more example of scope of practice. We want more states, including California. We know that California is lagging horribly in terms of full practice authority for advanced practice nurses. But I've talked to legislators before, and here's what I say, because it's with them, they have to get over listening to, if you want to be honest, the medical community saying that nurse practitioners and the like are unsafe, right? So really having information, accurate information, facts about the safety and the quality of APRNs is not enough. It has to be an economic issue as well. So I've been famous for talking to legislators and saying, look, you've passed all of this legislation in your state for universities to provide all of this education for nurse practitioners and advanced practice nurses. And then you're graduating, Mr. Legislator, all of these nurses in your state, and they can't even practice what they learned in school. Now, you tell me if that's a good ROI.
Yeah, definitely. I definitely agree with. I'm a little bit disappointed in California as well for not having
We
moved.
all
Because,
are.
yeah, definitely. I was hoping we'd be further along than we are. We've had some bills that have come through and just have not moved where we would like them to move, and advancing our nurse practitioners into full scope of practice, which I think it needs to be done. I mean, if this pandemic has not convinced people that we need more full scope of practice, especially in rural areas where we don't have a huge presence of medical centers and things like that, I think there's definitely a huge need for nurse practitioners to have that full scope of practice. So yes, definitely. I definitely agree with you. So this report, there's a new report that's going to be coming out for the 2030 report. And I had the pleasure of sitting on one of the sessions that you had via internet and listen in on the 2030 report of, I think it was your first session that you put out. So can you share with us what's going on with the 2030 report?
Right. So the 2030 report, it's called the 2020-2030 report. I don't know what the official title is going to be yet, but this report was to be an answer to how we were going to use all of the capacity we have now built in our nursing profession. If you want to take it as the first report was a lot about building capacity in the nursing workforce, go back and get more education, a baccalaureate, a doctorate degree, be on a faculty, make sure your profession is diverse, make sure you're sitting on boards. So if you want to take it as such that the first report was about capacity building, this second report is about, okay, now that we have built our capacity, and of course that's ongoing, we're never going to finish building our capacity, but for the sake of this conversation, now that we've built our capacity, what are you going to do, nursing profession, with all this capacity? And it's really to address what my foundation is really very passionate about and spending all of its money on, and that is the inequities in this country. Paying attention to the social determinants that people have in their lives, lack of education, lack of transportation, everything that's coming to light in this pandemic um, is really going to be the crux of this next report. So it's really, how will nurses help to address the social determinants in our country and inequities. And now with COVID, we're going to have some really very vivid descriptions about how nurses might do this. Again, it's another behind the closed door committee, as all the committees are. I am there as a senior scholar helping to lead this effort. And we have an extraordinary committee. The report was due to be launched this December, but because of the pandemic and COVID, we are delaying the report by about 6 months so that we can bring in all this extra information. And so our report, when it is released, it doesn't appear tone deaf to the nursing community. We would never want to come out with a report that didn't give credence to everything our extraordinary profession has been doing over the last couple of months here.
Oh, thank you for sharing that. Yeah, definitely. When we look at the inequities and the social determinants of health, especially like you mentioned, the COVID-19 definitely has brought a lot of that to life in an unfortunate way. We knew they existed, but now it's very much in our face. So how do we address that? Now I have a question for you regarding nurses wanting to be involved in these reports, like more active involvement. How can they do that? How can they move forward or build build a not necessarily a career, but like how can they get more involved? Let's say they're bedside, or let's say they're in academia doing what they're doing. How can they do more in supporting these reports?
Well, as you know, because you said in the beginning you had the honor of listening in on one of the town halls that we had. We had 3 big town hall meetings, one in Philadelphia, another in Chicago, and another in Seattle, where hundreds were in the audience and thousands were online. So we've heard from many, many people. Once people go to the website, the National Academy of Medicine website, and they look at the statement of task that the committee is charged to study and then make recommendations on, we've had many hundreds of nurses come forward emailing us on their thoughts and their ideas, and we take everything into consideration. Everything is a matter of public record, even though it's a closed process. It sounds kind of weird. Everything is a matter of public record. And then, of course, when the report does come out, let's just say in late spring, early summer, there'll be lots for everyone to do again. Just like the first report was a blueprint, and you read the chapters on leadership and education and everything, and then there are recommendations. You will see, and not everyone will be attuned to or feel passion for every single recommendation, but that's the beauty of a report with a number of recommendations, because any number of people can choose what they want and move forward with it. You yourself said you were compelled to go back and get your doctorate degree. You're teaching, you're on faculty, and that certainly was a very, very, very important component of the first report. So you really took heed of that advice, and I really commend you for that. And hopefully you and your followers will do the same for this next report.
Thank you. Now, is there any plans to build? You mentioned capacity. Is there any plans to build capacity for the state level action coalitions to not only continue with the first report, but also add this additional component to them?
Yeah, most assuredly. In fact, we just, this is a little bit of inside baseball, if you will, but we just sent an application out or a questionnaire out to all of our action coalitions. because even our action coalitions and the things that they have been working on over the last 10 years has changed. Over the last, I would say, 2 or 3 years, we've really been gearing our action coalitions more towards what I call building a culture of health and paying attention to social determinants and inequities. And so our action coalitions have been seeped in that material, if you will, over the last couple of years. And so they're prime now going forward with this next report. And so we queried them, do you want to continue as an action coalition? So I would say that almost all of them said yes. So that, I think that answers your question. We never know, how much money or support or anything like that, but we can say that the nursing community is still highly engaged. What a wonderful profession to be part of, isn't it?
Absolutely. Yeah, yeah. That's one of the things that I've, that I have seen, and you're on Twitter, and I know that's actually one place I have found a fantastic nursing community of
Yeah.
actively engaged nurses is, and looking at the work that they're doing in real time has been absolutely amazing. So yes, definitely, it's the people I have managed to surround myself have been are very charged individuals, and they're definitely still very much engaged in these types of reports and working with things like social determinants of health and inequities. And so, yes, very privileged to be in the profession of nursing. Anything else you'd like to share with our audience?
So, I'd like to say that I'd like to make a connection between what's going on now and actually a book that just came out, and it was just released a couple of weeks ago. So I thought I would mention that, but it's really, I wanted to make a connection with what our nursing colleagues, Allie, yours and my colleagues are going through right now. These are very, very hard times for nurses, but I'd like to say that nurses know what it's like to be called to action. You were a veteran. I've worked in disasters. Nurses really know what it's like, whether you are a veteran or been called to disasters or working on the front lines or teaching on faculty. We are a profession that's always up for the occasion. You know how we are. And so I probably around 3.5 years ago, I mentioned earlier in the interview, I lost my husband through a biking accident and had the horrible experience of being with him in an intensive care unit for 10 days before I lost him, before I had to help the nurses turn off that machine at the end, which was the hardest thing that I've ever done, certainly. But I kept a journal for a year, and it started at the beginning of my husband's accident and through the entire ICU experience, and then thereafter. And part of the book is about my own personal journey, but there's a good chunk of it too around, what it's like to be a family member in a healthcare facility when you're a clinician, and you see things in different light. And you see when people are compassionate and when they're not compassionate. And I take the opportunity in this book to talk about two nurses who showed extreme compassion and what it's like to be a compassionate human being. And so I wanted to mention that, knowing when we see the pictures on TV now about how nurses are going into rooms with their iPads and there's not families around, and they have to be that link between the family and a dying person. It brings me back to 3.5 years ago, to what a couple of those nurses did for me, and during non-COVID times. But how special this profession is. But that book has just been released on Amazon and Barnes and Noble, and it's
Fantastic.
called Resetting, because that's how I've determined my life to be. It's been a major resetting process when you lose such an important person in your life. and it's resetting an unplanned journey of love, loss, and living again. So I wanted to mention that again within the context of compassion, my latest passion, and as I see it now being played out on TV, we're so proud, aren't we?
We definitely are. And thank you for sharing that. And so sorry for your loss, but we learned so much from other people's experiences. So the fact that you took that and made it into a book, I'll have a link for this on my website as
Oh,
well
that'd be great, Ollie. Yeah.
for any of our listeners that want to go straight to your book and order. I'm going to go straight to your book and
Oh,
order right
good.
now after we're done here. So
Great.
looking forward to that read. With that said, thank you so much. Thank you for your time. I know you're very busy. Thank you for sharing your story with us.
It's been a pleasure.
You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources, and don't forget to subscribe. Until next time, I wish you fair winds and following seas.